Okay. Dr. Zymantas, let's talk about oral surgery. Why is there a need for oral surgeries? First of all, isn't everything surgery you take on, you pull a tooth, it looks like surgery to me, but, shed some light on why, special care has to be taken with some teeth, and it's called now surgery or oral surgery.
Well, oral surgery is primarily where you're working on the bones or the gum tissues in a lot of cases, say rebuilding bone for grafting purposes. Most oral surgery traditionally was simply extracting wisdom teeth, but there are other factors where you need to section jaw bones and reposition them. And more advanced techniques, those are done by more trained advanced oral surgeons. But say in taking out impacted wisdom teeth, there are many general dentists who do that as well. A lot of them do it with sedation as well to make the event kind of more or less comfortable for the patient. So most oral surgery, again, the most of the oral surgery that I personally do is placing implants, which is considered an oral surgery procedure, and extracting wisdom teeth. Those are the primary two ways that we do oral surgery in our office.
So does an oral surgeon have some extra special training which a normal dentist doesn't have, even though a normal dentist is definitely allowed to do oral surgery? But is there some extra training, and you with your thousands of hours, 5,000 of them of extra training, did you get some of that?
Yes, I have trained again with some of the finest specialists in the world regarding oral surgery. And in fact, one of the finest oral surgeons in the world is a general dentist. He's not even a specialist. He's a general dentist, and he's in my mind he's the top surgeon in the world. I've never seen anybody work with the care and skill and the precision that this man has. And right now he's about 77 years old. And even at 77, his skills are he's beyond almost human what he can do. But he is a general dentist, and he's trained a lot of oral surgeons as well. There's sometimes a little bit of a turf war from an oral surgeon not wanting a local dentist to be doing it because it's sort of taking some food out of his mouth in a way. But in dentistry, we can perform any procedure we've been trained for, and if you're trained for it, then it's more about what kind of training you have than what kind of degree you've got.
Right, because the basic degree, the degree you dentists have includes literally everything. After that, it's just that some of you decide to work on one particular specialty, one particular area of the mouth a little more, and thus specialists got created. Right?
Correct. Absolutely.
Yeah. Good. So basically, when a tooth is impacted, meaning is basically growing rather crooked, growing inside in or some such thing, right?
Correct.
Obviously, more work is needed to get them out, and you gotta get them out. Otherwise, I guess the tooth pushes all kinds of other teeth and creates real havoc in there, right?
Well, that's another controversy in dentistry, if wisdom teeth actually move the teeth. Personally, I'm not sure that wisdom teeth do move other teeth, but in most cases, the jaws are not simply big enough, long enough, wide enough in order to support another tooth far back in the mouth and to be able to be cleansed and maintained. And if you cannot maintain the tooth and keep it clean around the entire perimeter of the tooth, then in some cases large infections can start. In some cases they are life-threatening if you develop an infection on a lower tooth, and the pressure from the infection goes towards the windpipe, and if it's a rather aggressive infection, there are deaths associated with that, as well as septicemias from overly too many bacteria in the blood supply, causing damage to a lot of other systems in the body.
Got it. Why do they call a wisdom tooth a wisdom tooth?
You know, I'm not, something I should know. I believe it's probably because it comes at a later point in your life when you're hopefully have a little bit more wisdom.
Such as when? When does it come?
They'll come in right around 18 years old, 19 years old or so. Most of the time when I take out wisdom teeth, I take them out when they're a little bit, when the roots have not fully formed yet. If you wait too long, then the roots may kind of wrap themselves around a large nerve that supplies sensation to your lips. And on occasion, those, if that's torn, that can lead to significant numbness and a long-term and uncomfortable feeling. It's not something you want to have happen. So ideally, the ideal world is, on the average, 17-year-old kids usually need them taken out because they have their first. There's a couple of reasons. One is that their bodies will recover faster. The teeth are easier to take out because the bone is softer and the roots have not been fully formed.
Okay. And all wisdom teeth have to come out, or is there actually not all of them? If they grow nice, beautifully, and have enough space or whatever it may be, they don't? What's the deal there?
Yes, if there are people whose jaws are long enough, big enough, and you kind of watch over time and see what's happening. On occasion, there are people that can have the full complement of teeth, which is 32 teeth in their mouth. That's rather rare, though. I don't see too many people having that big of jaws, but that does happen. And the biggest problem is just trying to keep things clean around it. And when it's impacted, you can't keep it clean, so they need to come out.
Right. And does everybody get a wisdom tooth or not?
Some people don't get any wisdom teeth. Other people have multiple. I have a patient surgery coming up where they have, instead of having 4, they have 12. They have three. Yeah, they have 3 teeth on each side, 3 wisdom teeth on each side that we're going to have to take out. So it's going to be a little bit more of a fun surgery because it's more extensive.
I guess the sedation dentistry is going to come handy for that one.
Absolutely. Sedation dentistry will definitely make things more comfortable for myself, my staff, and the patient.
Well, all right. Here we have it. All about wisdom teeth. They can be there. They can be trouble. They don't have to be having trouble, and they sometimes don't even come. Bye-bye, Dr. Zymantas.
Take care, Mr. Flash.